Sarah has a problem. Some days she feels so depressed that she can hardly move. She feels like she's been hit by a truck, and just the thought of getting up, showering, and facing the day seems to be too much. Other times, Sarah is so energized that she can't seem to stop herself. She bounces around from room to room in her home and often tackles several projects at once. Her brain seems to go 1,000,000 miles a minute. She has so many thoughts that run through her head, and she just can't seem to stop them. Sarah suffers from bipolar disorder, a condition considered to be abnormal. That is, her behavior, emotions, and thoughts are different from the normal pattern that people display. One way of looking at bipolar disorder and other mental illnesses is the somatogenic theory, which says that mental illness comes from physical or biological ailments. Now, you might think that the somatogenic theory of abnormal psychology is pretty new, but it actually goes back to ancient Greece. Let's take a look at a few of the most important historical moments in the biological view of mental illness. Hippocrates was ahead of his time. Most people in ancient Greece thought that abnormal behavior like Sarah displays could be attributed to things like demons or magic. But Hippocrates was the first person to suggest that mental illness might be due to physical issues. Considered the father of Western medicine, Hippocrates believed that mental illness could be treated the same way that physical ailments could be treated. He said that the brain was the center of consciousness, wisdom, emotion, and intelligence. As such, Hippocrates believed that the brain was the place where most of the issues with mental illness resided. Hippocrates based all of his beliefs on philosophy. That is, he speculated on the link between brain and behavior, but did not investigate it scientifically. Years later, a Roman named Claudius Galen became the first person to incorporate scientific investigation into the idea of mental illness. He took Hippocrates' ideas and experimented on animals to confirm and discover more about the biological underpinnings of abnormality. After Galen, the science of abnormality didn't make much progress for another 1,500 years. Some people took the information that Galen and Hippocrates explored and used it, but mostly people went back to the view of mental illness being caused by demons and magic. In the 18th century, though, a doctor named Franz Anton Mesmer attempted to treat mental illness from a scientific point of view. Mesmer took the work of Sir Isaac Newton, which focused on invisible forces like gravity and magnetism, and applied them to abnormal psychology. In particular, Mesmer treated many conditions with magnets. At the time, hysteria was a common disease, particularly among women. Hysteria was the diagnosis when a patient experienced physical symptoms without anything physically wrong with them. One common belief among doctors of the time was that sometimes women's uterus could detach itself from where it was supposed to be and travel throughout the body, causing hysterical symptoms. Mesmer used magnets to treat these symptoms and had quite a bit of success in treating his patients. An interesting side note about Mesmer is that he believed psychological problems to be wholly attributable to physical issues, yet he is considered to be one of the first people to practice hypnotism on his patients. In fact, the word mesmerize comes from his name. A few years after Mesmer, Benjamin Rush became the founder of American psychiatry. His book, Medical Inquiries and Observations Upon Diseases of the Mind, was the first book on psychiatry published in America. Rush, like Mesmer before him, believed in the scientific study of mental illness. Rush sought to explain and treat abnormality in terms of medicine and science. However, Rush was working in the 18th and 19th century, and medical knowledge was slim. Rush believed in bleeding his patients, a practice common back then but disregarded today. However, some of the reforms Rush fought for have carried into modern day. He believed in the importance of sanitation and believed that violent and nonviolent patients should be separated. Both of these policies are still utilized today, 2.5 centuries after Rush was arguing in favor of them. If Rush was the father of American psychiatry, Emil Kraepelin was the father of mental classification. Like Rush, Kraepelin believed in the medical examination of mental illness. Working in the second half of the 19th century, Kraepelin devised a classification system for mental illnesses. This allowed doctors to view abnormal psychology in medical terms and laid the groundwork for the classification of mental illness that psychologists use today. As medicine advanced in the 20th century, more and more about the brain and its relationship to mental illness became known. chemicals in the brain called neurotransmitters were identified, and their role in certain illnesses became known. Drug therapy for mental illness became more and more common. Of course, even in the 20th century, medical advances led to some horrific treatments. As scientists identified parts of the brain responsible for different functions, treatments of some disorders involved removing the part or parts of the brain that doctors believed were responsible for the disorders. In the early and mid-20th century, a common treatment for some of the mental illnesses involved surgically removing parts of the frontal lobe of the brain, a treatment called a lobotomy. Another common treatment that gained popularity in the mid-20th century was electroshock therapy, or electroconvulsive therapy, which involved administering electrical shocks to the brain. Both lobotomies and electroshock therapy had dramatic side effects, though, and they are rarely used today. Instead, the most common medical treatment for mental illness today is drug therapy. Viewing mental illness as a biological or physical problem is called somatogenic theory, and it stretches all the way back to ancient Greece with the theories of Hippocrates. In the 18th century, Franz Anton Mesmer used magnets to treat patients with ailments like hysteria, while Benjamin Rush founded American psychiatry. Emil Kraepelin's work to classify mental illness in the 19th century led to the system used to classify mental illness today. Finally, advances in our understanding of the brain during the 20th century led to more advanced drug therapies, as well as treatments that have been mostly abandoned, such as lobotomies and electroshock therapy.